8:51 the time now. So, as we've been reporting, the longest single period of strike action in NHS history is due to take place next month as junior doctors in England walk out for 5 days in an ongoing dispute over pay.
They're going to strike from 7 o'clock in the morning on Thursday, the 13th of July, through to Tuesday, the 18th of July. More senior consultants in England could also go on strike on the 20th and 21st of July if they vote in favour of action. The result of that ballot is due early next week.
Down Street says the planned walkouts are concerning and hugely disappointing. Let's speak to Dr. Emma Runswick, who's Deputy Chair of the British Medical Association's Junior Doctors Committee. Good morning to you.
Good morning.
5 consecutive days. You've thought clearly about the seriousness of taking that decision. What concerns do you have? Address our audience directly in a way that they might be worried about the consequence in terms of healthcare of 5 consecutive days.
So I'm not any more worried about the healthcare that will be provided in urgent emergency and critical care on the days of strike action than I am about care the rest of the year. We have consultant and specialist colleagues who cover us during strikes for those kinds of urgent care. But we already have huge difficulties in staffing all year round because of the workforce crisis that this government has created through underpayment and mistreatment of staff. Junior doctors have faced real terms pay cuts of now over 30% since 2008. If we don't reverse that, more and more of us will leave and we will end up in a worse situation over time where we're unable to give patients and the public the care, the timely, high-quality care that they deserve.
OK, we'll come on to some of those negotiations in a moment, but clearly there will be an impact to health care. You cannot have 5 consecutive days of strike action without being an impact. And I take the point you made about urgent medical care, that can be covered, but wherein lies the services that won't be offered, because we've heard this before. There has to be an impact. You're well aware of this.
There's definitely a delay and disruption. But the government has...
You say that?
Yeah.
What does that mean?
It means that there will be appointments cancelled. Any non-urgent procedures will be rearranged. But if the government wants to stop that, they can. We've had over a week since our last strike action, and there's been no movement from the government in terms of re-entering negotiations. They still are consistently saying that they're not interested in moving from 5%.
I'm sure you will get to that in just a second. I'm just looking at some of these figures, and you can tell me whether you accept them. Walkout by junior doctors causing more than 100,000 procedures and appointments to be rescheduled. That's a lot of people affected.
It is a lot of people affected. But we already have 7.4 million people on the waiting list for procedures. And that's not because of the strike action. That's because we've had chronic underfunding, understaffing, various decisions made by this government and previous governments over many, many years. And if we don't change that, if we don't challenge the workforce crisis, if we don't reverse pay cuts, if we don't treat staff well, that will only get worse. Those of us who are taking strike action, including myself, want to give good care, timely care. I'm fed up of apologising to people every day when they've seen me only after 6 months, or my colleagues in A&E waiting 12 hours before they see somebody. We're fed up of that. We'd like to get it better.
How will a 35% pay increase mean that people won't be waiting for 6 months?
What we're looking for is pay restoration. So we're looking to be paid the same as we were in 2008.
So say you are. How does that then change someone from going from 6 months to a reasonable amount of time?
Well, at the moment, we've got over 9,000 medical staff vacancies in secondary care alone. Many of my colleagues are leaving or have left to Australia, New Zealand and Canada. If we pay appropriately, then some of those colleagues will return, more colleagues will stay, and we won't have the disastrous situation where we just can't provide the care because we haven't got staff.
OK, at the moment, the government's offering 5%, which it says is fair and reasonable. There is a massive gulf. We spoke to Matthew Taylor, Chief Executive of the NHS Confederation. I'm sure you're familiar with him. And I could see his frustration because you are so far apart. Do you foresee any compromise? Or is the feeling at this moment in time, if we don't get that 35%, we will continue. We will continue to strike. And these consecutive days of strikes will carry on. And regardless of whether it's now or whether it's down the line, people will be affected. Their care will be affected.
I think there is space. We've entered negotiations in good faith. We've explored a whole variety of options, including multi-year deals, things that are not in basic pay, affecting our exams, all of the other costs that we have. We're happy to find creative ways of building a workforce in this country that can really give good care. But the government are absolutely fixed on 5%, despite the fact that they've had for over a month an independent pay review, or supposedly independent pay review body, which the Times reports this morning is offering over 6% or suggesting over 6%. So they are not negotiating in good faith.
6% is nowhere near to 35%.
Absolutely, but over
if an independent body is saying over 6% could be anything.
We don't know, but they know, but they won't share that information with us. So that shows how poor faith the negotiations on their side are. We're quite happy to explore options, but the government don't seem happy to explore options at all.
We appreciate your time this morning. Dr. Emma Runswick, who's Deputy Chair of the VMA Junior Doctors Committee. Thank you for your time this morning.
Thank you.